So there's no question that polypharmacy is a major problem in older people. Drugs, as we get older, certainly make a big difference to people. We have a physiological decline. We peak somewhere around 30 years of age, and from then on, all our body systems go down at about 1% per year. So obviously, when we're around about 80, we give a drug that in a 30-year-old will do no harm, is quite likely to do harm in an older person.
For one thing, our organs work differently when we're over 65. So we may not need as high of a medication dose as we used to when we were younger. Another thing is we sometimes get a paradoxical effect or an opposite effect when we're using a medicine for one purpose and we get an opposite effect. So we see that a lot with things like Benadryl or allergy medicines, where somebody might take that and then get confused because it affects that person in such a way.
They experience different side effects, different interactions between the medicines, and typically are on too many medications, in my opinion at least. We really work on trying to get down the number because once you're on so many medicines, it really affects the way you think and the way you move. So I find that patients that are on more medicines tend to fall more, tend to get lightheaded and dizzy easier, and also their thinking tends to be a little bit slower.
Well, all drugs can interact with other drugs, and so it's a very common thing to see. A friend of mine, Stephen Fitzgerald in Australia, actually looked at studies that have been done and showed that when you're older, if you are on more than 5 drugs, the 6th drug will either make you better, has about a 25% chance of doing that, that's wonderful, but it also has a 25% chance of making you worse. So we have to start choosing drugs as we keep on adding them very, very carefully. And then we have to reevaluate if we give a person an extra drug to make sure it's not doing harm rather than good.
Other things to consider are things that are great for a younger adult that can prevent problems, and we get aggressive with their medical treatments to prevent things like heart attacks or strokes down the line. As somebody gets older, those medicines aren't going to be as effective because you need to be on them for a really long period of time to get some benefit from them, and after a while, people have they eked out all of the benefits from those medicines, and they really just don't need to be on them anymore, and the risks of them are a lot higher than the benefit.